the screen instead of
Yeah,
the
I
bottom.
got it. I think I got it
Okay.
now. Yeah. It's just in a different place. So you're right. When you start screen sharing, it changes how everything looks, and
Right.
it makes it confusing. Well, I think I'm recording. Anyway, all right. So we were talking about the concerns with some of the course material, and I was just discussing the issues with how old some of the material is, and that's primarily because the educational material dates back thousands of years. And it's still relevant today. You know, questioning students is sort of the hallmark of what we do. If you are teaching students, and if you're not, if you're teaching staff, same thing. You're always asking questions, and questions of inquiry are as relevant today as they were over 2,000 years ago. And you know, the Socratic method sometimes gets pushed away for things like learning styles. But you probably know my feeling on learning styles now, based on what the evidence says. We know that learning styles don't necessarily mean that we're going to have adequate outcomes. And that's what we're really going to talk about today, is how the objectives and everything sort of tie together. So when you put your PowerPoints together and your presentation for the end of the semester, you kind of know what to expect, or what you should expect. So if there are no further questions, we'll go ahead and just proceed, and we'll move from there. Is that okay? All right. So last week we were talking, and we finished up with this summary. We talked about, you know, if you're thinking, you're learning. And you know, Socrates was really big on introspection, and that's something you have to get your students and staff to do. We talked a little bit about one of the things that I did with my students when I got back from Albania was I stopped giving them PowerPoints. And when I say that, I stopped giving them handouts. And one of the reasons for that was because they were too reliant on that, and they weren't doing a lot of introspection. In other words, they weren't internalizing the information. So what I found is that they were learning less. They wait for you to just give it to them. And unfortunately, that can do more harm to the educational process than anything. If we can engage in some type of conversation and stimulation, I think a lot of you wrote on some of these ideas this week, and I think we're really good, because that's what you want to do. I mean, with patients, you have to do that. You have to get them, you have to have buy-in, and one way to get buy-in is to get them involved in the conversation, or in other words, you have to engage them. So we talked a lot about last week, if you can get to their why, then you can help them achieve what they want to achieve. We need to ask those other questions: who, what, when, where, and how, but ultimately an adult learner wants to know the why. And then lastly, you can change their world through proper questioning, because sometimes, and that's what the spirit of MI was about asking the right questions to evoke a response, so they begin to internalize what they feel is most important to them, not what is important to you, but what is important to them. So today we're going to talk about goals. All right, so real quick, how do you define a goal? Anybody?
Something you want to accomplish?
Okay.
Yeah, something you're striving for.
Good.
Yeah, basically what they said.
Okay. How about this is the acronym GOAL. I came up with this a number of years ago when I was talking to my students one day. And actually, this came out of something I was doing for mindfulness classes that I was doing. And so getting on with active learning. Okay. Another way to phrase that is getting on with active living. But for this course, I use learning rather than living. So for the mindfulness class, it was about getting on with active living. So when I wanted to help a patient establish a goal for what they wanted to achieve in the class, we would talk about how they would want to become more active in their living process. And so goal kind of reminded us of what it really is. In other words, you want to get on with that activity. You want to move on. And so in other words, it's sort of a what? It's a target or a goal, right? Let's see if this is not going to move here. So in other words, we got a target, a goal, a home run, a soccer goal, whatever it is. It's something that you want to achieve, and that's where we have to start. So again, who, what, when, where, how, and why are the questions we want to ask. So the teacher or the instructor, the professor sets the goal and uses it to measure the achievement. So what you're doing with objectives is you're trying to establish your target. I just want to draw your attention to this one thing. Bloom's taxonomy has changed over the years. And the only reason I'm bringing this out is because the next part, we're going to talk about this a little bit more in detail, is that in the old school method, Bloom's taxonomy stopped at evaluation. In the new school, after 2001, it moves up to creation. And this is ultimately our goal. Is to create an outcome. In other words, I mentioned to you last week that one goal is to make sure that you in other words, stay on the top end of the pyramid when you write your objectives, because if you do, they have to be able to do the bottom three in order to get to the top three. So there's not necessarily a reason to write goals on the remembering level, or maybe the understanding level, but certainly the remembering level. If they're going to create something, they're going to have to understand it. They're going to have to be able to apply it. They're going to have to be able to analyze it. So always refer to Bloom's when you're writing your objectives. Don't feel bad about it, because I still do it. I go, what would be a good term to use here to target the audience? Another rule is to use the ABCD method, which is basically to get to the who, ask who your audience is. What behavior do you want to evoke? Under what circumstances and conditions do you want that to happen in? And how well, or to what extent or degree that they want to achieve that? In other words, what is your target? Do you want them to be able to set up a ventilator, or just to understand what a ventilator is? There's a big difference. We also have to set objectives at the cognitive, psychomotor, and affective level. Now, I think everybody knows the cognitive and, of course, the psychomotor. What's the affective? Anybody? What is the affective domain?
Is that like confidence?
No, close.
'Cause I know that affect is kind of like your mood or something.
Oh,
It's
there
just
you
not-
go. There you go.
Yes,
Behavior. You're
behavioral.
right. Exactly. How do you want them to act? In other words, all right, so I know some of you are involved in, I don't know who all's, I can't see who all's on tonight, but I know some of you are involved in teaching at a college level. COARC requires these three levels of domain of learning to be taught. And with each domain of learning, in other words, as your overarching goal is to produce advanced practice respiratory therapists, would be, how would you want them to function at a cognitive level, psychomotor level, and an affective level? In other words, behavior is what affective is. So in other words, if you're performing a procedure, in what manner should they be performing that procedure? How should they engage people, et cetera? We don't want somebody throwing needles across the room. And I say that because that's actually happened. We had a student once that was frustrated because they couldn't get the skill down. And in the middle of the class, threw a syringe without a cap across the room, nearly hitting a couple of students. Now, was that the kind of behavior we wanted to have them display? I'm curious as to what you would have done.
I would have sent him home.
Yeah, I would have sat him down and had a very stern discussion.
Okay.
I would have
Anybody
asked him to leave. I would have asked him to leave.
Well, we did all the above. We told them at that moment, I think it's probably good that you step away, and we'll have a conference after the class. So if you'll hang around, you can wait out in the lobby, whatever you would like to do. We finished up with class. We had that conversation, And basically it was, you know, let's look at the behavior that you exhibited and how would you assess it? So we didn't tell them what they did. We had them tell us what they did. Why did we do it that way?
So that he could own up to what he did.
Correct.
He would realize it.
Right, exactly.
Did he throw this needle across the room out of anger, or was he just like, what was it? 'Cause he
Yeah,
couldn't.
yeah, it was anger, frustration, all the
Oh.
above, you know.
Oh.
You know, and you know, obviously that raised concerns with us. You know, so here's the thing, and this is something you have to, if you're going to be teaching or you're going to be a manager, and you have somebody who displays poor behavior like that. I can tell you, at least from an educational standpoint, in most cases, educators are very reluctant to withdraw a student because of poor behavior like that. And the reason is they believe that it's difficult to judge. Now, I've never had a problem judging behavior. In fact, out of the 14 or 14 colleges that we have, I was probably the only program director that ever withdrew students for poor behavior. And what I mean is they had good grades and they can do skills, but they had such poor behavior that I felt they were a danger to a patient. And the way we did it was we got them to own up to their problem. We got them counseling. And through counseling, they realized that this was not what they should be doing. So instead of just saying you're out of the program, what we did was we took them through the process of really understanding what the issue was. And I never had one student who we went through that process with that ever appealed it, because we were very conscious of the fact that if we just gave them a bad grade for poor behavior, it wouldn't fly. And that's typically what happens in a college setting. Deans and vice presidents are very reluctant to just get a student withdrawn because of poor behavior. But in my job that I do today, basically that's what I'm doing all the time. You know, we're sanctioning and revoking licenses for poor behavior. I have no compunction against that. I think it's something that all of us have to do as professionals, is have people own up to their behavior, because they can have all the skill in the world, but if they have poor behavior, the outcome for the patient is going to be bad. So here's the mistakes you should avoid. Forgetting the steps, number one. Number two, writing an objective that is unattainable. And this is something I had that I was going to see if I could find it. I had all these great objectives that were sent to me via our continuing education system, and I just wanted to share with you some of them, because I think they're important to look at, and I want you to evaluate them. I'm going to wait until that comes up real quick. So we're going to look at those objectives in just a minute. What's unattainable? Give me an unattainable objective. What do you think would be unattainable to achieve? Or does unattainability be dependent upon the time frame that you're dealing with as well? So give me one that you might think might be unattainable.
I know one would be like an objective that's like, student will, understand the pathophysiology of a disease, because understand is not really measurable.
Okay, well, you could measure some of it, right? But you couldn't measure the entirety of it. What would be a better way to put that?
Student will verbalize instead of understanding, put verbalize, so that you can hear them say it and then you see.
What about the student will be able to explain the pathophysiology of COPD?
Yeah, that'd be good.
Okay,
Get a better idea of it.
right, because what did we say last week? If they teach it, they will learn it.
Right.
So even if they get it wrong, I don't care. I don't care if they get it wrong. What I want to see is how well they, in the affective domain, how much effort they put into understanding it. Because we can straighten out all the things that aren't right, correct? And I mentioned the disease maps last week, and that's why I did disease maps, because I wanted every student to be able to, at some point, be able to explain in full at least one condition. Now, you might say, well, why not all of them? And the reason for that, all of them is what? Is that obtainable? Or is one reasonable? In other words, from a student perspective, is having them explain all of the conditions that we have to the class and obtain an attainable goal. Does it invoke fear in a student if they had to do that? And would that be a barrier to their learning? What do you think?
I
No,
think it puts a lot of stress on a student to have to learn all of them. And so it would be easier to learn or get it, like I said earlier, a better understanding of one versus 20 or 30.
Okay. You know what's remarkable is when you do one, all you have to do is change a few things in the disease map to go to the next disease, and to the next disease, and to the next disease. And what's really cool about that is when you show them that after they've done one and they've really nailed it, right?
Right.
And I would go up on the board and I'd start erasing things. And I'd say, okay, well, if it's this condition, here's what we don't have. Or here, if it's with this conditions, here's what we have in addition. So it becomes sort of this idea of, I learned one, I can learn them all, instead of, I can't learn them all. So you give them one task, one attainable goal or objective. And once they achieve it, getting to the other ones are much easier, because you don't want them to get blinded by the forest. You want them to see that one tree. You want them to understand that tree and feel good about it. And that's what a mind map is. It's a tree. It's a tree of ideas. And that's why I love that technique. And so from the summer through their entire second year, we did nothing but we either did mind map, well, there were always mind maps, but they were either pathophysiology related, but I would take them and pull them into the Sims. And this way they could connect the dots, you know, and they owned the material rather than memorize the material. And there's a big difference between those two elements. Writing objectives that do not relate to the goal. It's also similar to writing a paper, having an intro and the conclusion have nothing to do with the intro. Because what you're stating in the paper when you write one in the intro is, what are your goals? What's the purpose of this paper, right? And in the conclusion, you should wrap it up. Well, the same happens when we're writing objectives. We have to always go back to the goal and say, does it apply to this goal? And if it doesn't, what's going to happen? Well, you get confusion, bewilderment. They start to get, you know, just discombobulated in terms of understanding why they're doing what they're doing. In other words, you miss the why. So you always have to keep them focused on the why, which is, by the way, why I like questions, because it helps you focus on the why. And, you know, if we're having you know, one of the things, if I'm doing a conference, because I can see you eye to eye and I can pick on you a little bit, and you know, we can have a little bit more of a back and forth conversation because we're not restricted somewhat by the technology. And I can see, you know, things like you know, body language. I can see curiosity. I can see, you know, in other words, I like to have a face-to-face because I can really see what's going on in the audience. So it's easier to play off of that. Sometimes I find when I'm speaking, because I've had to do these conferences and meetings and things, and I'm sure all of you have, everything since COVID started, and I miss that sort of personal interaction that you get with an in-person meeting. Because sometimes what happens is you sort of lose some of that focus. But when you write an objective that doesn't relate to the goal, it's really important to understand how that can really disrupt the whole educational process because it doesn't lead anywhere. All right, so I had one today, and this is what I wanted to show you, is describing what the instructor is to do rather than the learner. And let me see if I can let me see if it's come up yet. Oh man, it may not come up because I'm on show. There we go. Let's see. So just ignore my emails. By the way, it's all public information. CE approval. And if you know anybody, I think Terry, you'd be the only person who would know anybody here. I want to see if I can find this one. Quit. Okay, I'm gonna see if I can expand this real quick. All right, so we're going to ignore the outline of the program. What do you see as the problem? Whoops, I got all of that just all of a sudden. There we go. That's perfect. All right, so these are CE requests that we get, and we have to approve them. What do you notice about these objectives?
Just like you said, they relate to what the instructor needs to accomplish versus what we want to achieve with the students.
Exactly. There's some in there, but that might apply. But when you read it, is the individual will be able to review? How long does that take? How long does, all right, so for example, Patty is always good at doing these things, but 5 hours is the request for moderate sedation, all right? So I haven't responded to this yet because the committee just approved it, but as I look at it, I wanna go back and ask her some questions. All right, so you're gonna review the standards, review the goals, review and explain the anatomy. All right, so, okay, so review the Joint Commission standards. How long does that take?
Way more than 5 hours.
Well, yeah, but I mean, the bottom line is you can have them review it, but is it realistic to review all the standards in the class when you consider all the other things you have to do? And you said it's going to take more than 5 hours to review them all anyway. And even if you review them, all right, so you review them, you check that box, you've measured it, they've done. Does that mean they've learned them? Does that mean they can apply them? Or here's another one. Review the goals and clinical endpoints of moderate sedation and analgesia. Okay, so you review it. What do you do with it? Well, in the next one, they go review and explain the respiratory anatomy as it pertains to the patient undergoing moderate sedation. All right, so what would be a better way to state that one question, that one objective? Do you need review?
No.
Okay.
Maybe if you said, instead of review, maybe if you said, well, like you said before, like explain or something.
Okay,
But,
you could say explain. So the student or the participant will be able to explain the respiratory anatomy and physiology as it pertains to undergoing moderate sedation. Or the participant will be able to explain how moderate sedation impacts the physiology of the body. I mean, something a little bit, I mean, because really the anatomy is the anatomy, right? What are we really talking about it doing? We're really talking about it, how it impacts the body physiologically, right? I mean, you have to understand the anatomy to understand the connection to what you're talking about. But if you could just eliminate anatomy and just say the physiology, you know, how does it impact the physiology of the patient? So you could sort of really narrow it down. The other one, review current practice guidelines. Well, could you do that before the conference or before what they're doing? Could they have them do that before that period?
Sure.
Yeah. So you could walk in the door, they've already reviewed the practice guidelines. Then instead of saying review the current practice guidelines, it would be the students will be able to what? What would be a term we could use that would take it up a notch?
Get a better understanding.
Okay. Any
Like
other ideas?
verbalize?
Okay.
Hmm.
How about implement?
Okay.
And how
Yeah.
would you measure implementation?
By using it.
Yeah, so how would you use it?
I guess you'd have to get them to either, you know, like maybe do it on a mannequin or something.
Okay, you could certainly do that, like an ACLS type style simulation. That's what I was thinking. But yeah, you're on the right pathway. You could also do, you know, if you had the technology available, you could create your own simulation, and it could just be a case study, you know, that you could present and have them apply the case, you know, have them apply it. How would they follow the guideline? You know, there's a number of ways you could do it. So you're not locked in to one way, but you know, you have to consider time frame. You know, what do you have time to do? And if you want the whole group to do it, could you do a group session where they would all figure out how to apply the guidelines, which would also get them to collaborate?
Sure.
Okay. So you see where I'm going with this. One, this is for the level, okay, also consider this. If you're considering somebody who's doing conscious sedation in the hospital, if you're training a therapist to do this, wouldn't you want them to have a much higher level of outcome to this process if they're going to be administering these drugs?
Yep.
Absolutely. And that's what you have to consider. You have to consider, what is your level of your audience? What is your goal? Is your goal to get them to be able to do conscious sedation? And that's exactly what this is for. Let me give you some backstory on this real quick. This is actually, we have a declaratory ruling on conscious sedation. So therapists in our state can actually administer the conscious sedation drugs provided they go through the 5-hour class. And as long as they're with the physician in the room. So they can administer any of the pharmacological drugs as long as the physician is in the room, so they don't have to have a nurse in there. And that's through our conscious sedation declaratory ruling. And it's connected to our endorsement program, which requires them to go through this training and then do a certain number of cases per year. So as I look at this and understanding, you know, I understand what the goal is. I also understand that this level of objectives aren't going to really meet, at least in terms of I know they're probably going to do more, but it's not going to really meet the outcome of competency for this procedure, because you got review. We have very little on the application, the implementation, the creation of a post sedation care plan. I mean, there's all sorts of things you could do, but you kind of get the idea, right?
Mm-hmm.
Okay, so we have to dig a little deeper and not just say, well, oh, well, that looks good. And that's what typically we do. And you're right. What they did was they described what the instructor was going to do rather than the learner. Including more than one expected behavior in a single objective. I think we saw that in a couple of those, correct? You want to keep it simple, because if you don't, it'll get confusing. then cluttering it with unnecessary information. I think we also looked at one example or two examples of where they had too much in one objective and the objective really didn't accomplish what they wanted to. So going back to your gap analysis that you did in the first week, the whole idea behind the gap analysis is to help you establish those objectives, because you have to find out first what's your performance gap. So the gap helps you determine what the target is or what that goal is. The other one is being too general, and I think we had a couple of examples that I did. Just so you will know, I didn't actually know that was the one I was going to end up with when I pulled up my screen with that. But that was a perfect example of some of them being too general, while others were way too complicated. And you know, again, the goal of the program, the aim of that program was targeted at getting practitioners competent at conscious sedation. And based on the way they wrote the objectives, do you think they would accomplish that? Anybody?
Are you speaking of the objectives that the individual wrote in the email to you?
Right. Do you
No.
think?
No.
Okay. So good. You realize that, yeah, that's not going to work. So whether you're an instructor, a manager, you know, whatever your position is, you have to stop and think, reflect back on the goal. If I want them to be competent in conscious sedation, will those objectives get them there? And if the answer is no, then you've got to redesign that. And it's not that you may not be teaching that, it may be that the focus is lost. If a student reads that, they'll go, oh, all I got to do is review it. Great, then I'm competent. Not really, but that's sort of how they see things sometimes. Well, I got that. I went through the class. I should get the grade. And I actually had students say that to me before. Well, I did what you said. Yeah, but you didn't actually score it on the exam. Well, but all you said here is I had to review this material. You didn't say I had to learn it. I actually had a student tell me that one time, and I thought, oh my gosh, I really messed up. You know, so sometimes they take you literally, and so I had to be really careful from that point on to say, and this is how we're going to measure that result. You know, so everybody makes mistakes. What can I say? All right, so one of the acronyms that you'll learn is about being smart. Be smart as you build your objectives. And that acronym actually comes from this. Be specific. It must be measurable, achievable, relevant, and time-bound. So in other words, it can't just be open-ended, right? Because you have a time limit on what you can do. And unfortunately, we just can't give it forever, but regardless, that specific, measurable, and achievable is really important, which is what we looked at just a few minutes ago. Some of them were specific, but they weren't really, well, I guess they were measurable, but they weren't specific enough to the goal. And yes, they were achievable, but again, was it achievable to the point of getting them competent? And you've already said no. It was relevant, yeah, but it wasn't going to get them to the goal. So in other words, they weren't really being really smart with their objectives. They were putting objectives down because they had to have objectives in order to get the course approved. Lastly, and we'll stop here, this is how you connect the dots. So when we're talking about objectives, we're down here. The goal is to make sure it aligns with the university, school, college program goals. So where are you along this spectrum? If you're a program director, you've established goals, then you write program objectives to get to that goal, and each course has the student objectives, and then of course each unit does. So you sort of have this layered effect of objectives and objectives and objectives, and it seems redundant, but you really do need to understand that it has to all connect. Years ago, I was asked by our institutional effectiveness department, well, technically I asked, they were going through and developing student learning outcomes, which are technically below program outcomes, okay? So program outcomes, student learning outcomes should feed into program outcomes and goals. You could probably even say that program outcomes were student learning outcomes. But the program outcome is what the program would do. The student learning outcome is what the student would do to get to the program goal. So within that student learning outcome, we would have to build upon that. Well, these are all this terminology, student learning outcome, is really nothing new. It's just a reformulation of how we establish goals and objectives. But nevertheless, health sciences at the college that I was teaching, we all had program goals, program missions, and program outcomes and program objectives. What we didn't have were course objectives, meaning that the course objectives were clearly written to feed into the student learning outcomes or program outcomes. But the other curriculums had none of this. I want you to let that sink in. Our health sciences in general, nursing, respiratory care, all of this, we do this daily, working on this. But if you went into the history class or the history department, the English department, or whatever department you're going into, any university, they had none of these things. They had no program mission, no program goals, program objectives. Yes, they had course objectives, but without the top, it didn't mean anything because they weren't going anywhere. So it was interesting to see people with master's and doctorate degrees who had never written a goal or a program mission. And we ended up having to help them along to help them understand how all of this fed into the overall product. And that's in part of the problem with education is that, and I want you to think about this for a second. And this is what's really cool. Do you realize that respiratory therapy education set the standard for program goals, student learning outcomes, and outcome-based education, which is what we're talking about? When you look at COARC guidelines, when you look at the NBRC matrix, a lot of times people just see that as information. What I see is that was a standard that was set more than 50 years ago. So think about that, 50 years ago.
You mean it set the standard for all healthcare education, you mean?
Well, for a lot of them, because the NBRC in their sister organization before they split, the side that actually did the testing, developed the testing matrix for over 100 other professions. COARC, in the form when it was Joint Review Committee for Respiratory Therapy, the original, they helped set the standard for outcomes-based education in health sciences. Occupational therapy, EMS, surgical technology, all of these groups came to them to help them understand how to do this. I remember going through and helping our EMS department go through this whole accreditation process because KHEP, they were now being approved by KHEP. And of course, we had previously been through through KHEP. Now we were COARC, but they all came to COARC, or like I said, Joint Review Committee, and they were actually providing input on a lot of these programs. Occupational therapy, like I said, EMS, and I know surgical technology and a couple of others. Nursing, I want you to frame this, just think about this for just a second. You can say 100% of all respiratory programs are accredited independently by COARC. They all belong to either a regional or a national accredited institution, but they all are accredited by COARC, correct?
Mm-hmm.
Can you say that about nursing?
I don't know.
Probably about 50% of all programs in nursing are accredited independently. Most of them are approved by their state, but they're not approved by necessarily accredited by a national organization. There are 2 national organizations for nursing accreditation, but they aren't required. At least they might now, but I know that a couple of years ago, they were not required to have that, as opposed to ours, which is they have always been required to have accreditation in order to sit for the boards. So
there's no national standards for them?
no, there are national standards. The thing is that because nursing preceded licensure for nursing preceded accreditation of programs, licensing boards took on the job of accrediting within each state. So prior to them having an accrediting agency, each state approved each program, and many programs are still approved by the state level nursing boards.
I see.
They have been moving towards national accreditation to separate the nursing board from the nursing education. But respiratory therapy was really 50 years ahead of their time, because we had already accomplished that 50 years ago. And it's only been in the last 10 or 15 years, I think probably 15 years now, that nursing had a national exam that everybody took, as opposed to having state exams. Now, their exam is a very well respected exam, don't get me wrong, but they didn't always have that. We always had that. So that's one of the things that I always try to convey to our audiences when I go and speak to the state level. How does this apply to what we're talking about? It has everything to do with, they established a very methodical way to achieve program outcomes. And it's very stringent. And even though it's one of the toughest accrediting processes out there, when you go through it, you realize the rationale behind it, because you can see the scores for individual schools and you can measure the outcomes. That you know that over the 400 schools that are out there, they all have to meet the same outcome. That's a high degree of validity and reliability for an outcome. I mean, it would be equivalent to having every hospital in the nation achieve the same level of outcomes for their patients. And I think sometimes people don't realize how significant that is.
Yeah.
And personally, that's what makes me proud to be part of education in respiratory therapy, as I've been all these years, because even though it's tough, it's an example for everybody else. I think it's cool. So that's all I have tonight. I kind of got carried away on that last part, sorry. Any questions?
I have one question. How do you decide like how many objectives? Like if you were going to give, how many objectives is too much? So like if you were going to give like a 30-minute lecture, would you say, well, 1 objective per 10 minutes, or how would you decide that?
Depends on the level. Where do you, in other words, where are you along the Bloom's taxonomy? If you're just talking about introducing them to concepts, you could do 3 in 30 minutes. But if you're talking about having them understand the pathophysiology, I think probably 1 in an hour might be plenty. It just really depends. Our rule of thumb is you have to have at least for every hour 1 objective to complete. But if that objective is to review the terminology of respiratory therapy, well, you could make it an hour, but that would be kind of boring. I generally, for every hour that I have when I talk, I generally have at least 3 to 4 per hour. And again, breaking it down at 15-minute increments as to what I want to do. Some of them I can accomplish very quickly. And that's okay, you know, because if you want to focus on some other aspect of it, you can do that. You know, so just don't overload it with too many, because then you start wondering, am I completing that one? I can tell you if you have more than 4 per hour, you're probably overloading yourself. 1 might be sufficient. And speaking of that, by the way, when I've read some of the journals that everybody's been doing, and I don't know if I've necessarily commented on yours on this, but let me just throw this out there because I know I have on several others. Is if you've already got your capstone, sort of you're gearing your capstone and you haven't completed how you want to achieve it yet, just remember you don't want to ask a bunch of questions. You want to ask the most relevant question. And if you want to have a really good, solid presentation, ask one good question and answer it, and then extrapolate from those results what you might also be able to apply it to and what other questions might arise. And I shared this last year with the group. My dissertation answered one question. It took me 100 pages to answer one question. So in other words, if it's a well-constructed question, you could spend a lot of time answering that question and become a real expert at whatever your capstone is. And that's sort of where you want to be. Okay. So that was just something that I wanted to throw out there because I know that I won't be able to comment on everybody's because they may not have put that in their journals.
Okay, thank you.
Mm-hmm. All right. Well, if you don't have any other questions, I guess I will talk to you later. And somebody needed to talk to me. Was that Tricia?
Oh, yes.
Okay. So you want to call me tomorrow or what do you want to do?
Yeah, sure. I can do that. I can email
Okay.
it tonight and then see what's the best time to call
Okay.
you tomorrow.
That's fine. That sounds good. All right.
Hey, can I get in on that too? Can I have a little bit of time to talk to you also? It's about my.
Yeah, I've got, let me think. Tomorrow I'm going to be working from home. So it just depends on what time you want to meet. So Tricia, what time do you want to meet?
Anytime during the day. I work at night. So.
Okay, so I'm on Eastern Standard Time. So
Yes, I'm on the Pacific time.
okay, so let's say 11 o'clock. Would that work for you? I'm sorry, 11 o'clock my time, which is 8 o'clock your time. Sorry.
Yes, I believe. Actually, do you have a little bit of a little later time?
I mean, I could do, 12.
Because I just would get off of work.
Oh, okay. Well, that's right. I mean, it's hard to think that way. All right. So, I mean, I can do, I believe you want to do 1.
Okay, sure.
Okay. Just call me though. We got my phone number in the syllabus. And Jim, what would you like to do?
I can pretty much work around your time. I have the whole day off.
All right. So let's do 11 then. Oh, wait a minute. Let me back up. What time zone are you in?
I'm in Aurora, Colorado. I'm in Mountain Time.
Okay. So you're two hours behind. So 10 o'clock, would that work?
10 o'clock my time?
No, 10 o'clock my time, which is 8 o'clock your time. Sorry.
Yeah, that's good. Sure.
Okay. So just give me a call and I'll have my phone on. And I'm usually at my computer a lot earlier, as you can tell when I answer emails.
I'm sorry, I made a mistake. Can I make it like an hour later?
So that's 11 o'clock my time. Yep.
Is that good?
Yep.
Okay.
I can hop on to that an hour later after Jim, so you don't have to. There won't be a gap, and so
Okay,
that way, you know.
All right, that's fine. So you're going to be Jim's going to be at my time at 11. You're going to be at my time at 12.
Okay.
All right, so I got that now.
Okay. And
Okay.
your phone number is in the syllabus, right?
Correct.
Okay, great. Thank you very much.
All right, y'all take care.
All right. Bye.
Bye-bye.